ठीक है. Then we'll start it. I think everything is perfect. So we started this initiative last week, and basically I started because I really want to educate people, especially women, because we always take our health as a backstage. So even when we are flying in an aeroplane, what the instructions are given, you put your mask, oxygen mask first, and then try to help others. Because when you are not able to oxygenate yourself, then definitely you won't be able to help other people. So as a woman, if we take care of ourselves, then only we can take care of our family. So those who have attended my last session, so every time we are just talking about screening, screening, and screening. And what is this screening actually is? Screening is something like any disease which has got its own course. Like it start with a minor thing, and then slowly the course of a disease increases, and then it will be full blown, and finally at some stage it start affecting us, and then finally we become susceptible to the disease. So screening is something when we are able to detect that any disease at a very early stage, when it is like going to affect us, or it has already just started affecting us from a just a very early beginning. Maybe if we'll do something at that stage, we'll be able to cure that disease and can live a better life. So last time we were talking about the osteoporosis and a heart disease in the women. So in a recap, I want to, those who have missed the last session, osteoporosis is something which affect with the aging. And how can you prevent it? Definitely the key of all the diseases is a healthy lifestyle. At least 1,000 milligram of calcium in your food, and 500 till menopause as an additional supplement, and 1,500 after menopause an additional supplement. And definitely with along with vitamin D and weight bearing exercises, and complete cessation of smoking, completely avoiding alcohol. So that was the main, just the summary what we discussed last time. So now this time we are going to discuss about the what are the most common cancers in a woman which affect us. So why, as I told, early detection can save lives. So any disease, if it is detected very early, can be treated properly, and even cancers are 100% curable. Unlike what previously we used to think, if the cancer word comes, itself we get scared. Oh God, I'm not going to live, or what will happen to my family? But now the medicine has progressed so much that even most of the cancers, when they detected early, the lives can be saved, and most of the cancers are curable, except few which are very fulminant cancers. Okay, so this, as I told you, why screening? What is screening exactly? I've already explained that when we detect any disease in a very early stage. So all the screening has got some specificity and sensitivity. Sensitivity to detect the disease in a general population, and specificity to specifically screen that disease. So any test which is having a good sensitive and specificity can only are taken as a screening program for all the disease screening programs. So by detecting the any kind of cancers early, before even the symptoms appear, before we even realize we are having a disease, can definitely cure that disease and increase our overall outcome and survival. And definitely better, uh, we can prevent ourselves from the mortality and morbidity of the disease. So in women, what there are many cancers overall from head to foot. You can get any cancers from skin, eyes, ear, nose. But we are not talking about the rare cancers, which is not very common in population. We'll be talking only about the very common cancers in the women population. So topmost is a breast cancer. Next comes a cervical cancer, then ovarian cancers, breast cancers, and colorectal cancers, and lung cancers. Okay. So we all know what is breast. So I think all of us know what is this breast. So breast cancers, we have already heard about many our relatives, maybe friends, and get affected by it. But what is cervix? Cervical cancer is a mouth of the uterus. So, can you see this specimen? So this is the mouth of the uterus, which is a cervix. So here is the cervix. So this is uterus, this is cervix, and these are ovaries. So we are talking about this cervical cancer, which is the mouth of the uterus. And these are the ovaries which forms egg every month, and we get pregnant because of those eggs. So ovarian cancers and colorectal. Colon and rectal means bowel, the large bowel, and rectum. So those cancers and lung cancers. Okay. So breast cancer is one of the major cause of deaths in the women, and these are the most common cancers which get affected. So any when we should start a screening for breast cancers. So any woman more than 40 years of age should start the screening for breast cancer. But those who have a family history of cancers, breast cancers, like your mothers are getting affected, your aunts are getting affected, if your sister has got affected, then those patients can start it early, maybe in 35 also. And most sometimes it is seen that some of the breast cancers are associated with ovarian cancers. So if there has history of ovarian cancers in the family, then it is advisable that patients should also think considering there's a screening for the breast cancers. How it is done? By a mammogram, and frequently every 1 to 2 years, depend upon your previous reports or whether you are doing for the first time, and self breast examination. So we'll be seeing all these things in detail now. So what are the risk factors for breast cancers? For any cancer, there are two type of risk factors. One risk factor which can be changed, which are in our hand. We can do something for those risk factors. And one risk factor is something which cannot be changed, but they are in our genetic. So we can't change those genetic constitute how genes are made, how our DNA is being made. So we can't do much about those things. But what can be done, like those are modifiable risk factors, we can work on that. And definitely the chances of cancers can be reduced if we work on those modifiable risk factors. So breast cancers, as age itself is one of the risk factors. When you start aging, your cells become old and your DNA start disintegrating, and then you become prone to get many cancers. So age itself is one of the main factor which can be prone for the cancers. Then secondly, genetic mutation. As I've already told, that BRCA1 and BRCA2 genes. So those who are having the family history of cancers, though they should get screened for themselves for BRCA1 and BRCA2 genes, because it is seen these two genes are very, very highly associated with people getting breast cancer. Almost 40 to 50 percent of women, those who have these genes, are prone to get breast cancer. So we have seen many celebrities also who had a mastectomy because they were susceptible for BRCA1 and BRCA2 diseases, genes. Then next comes our reproductive history. So early menarche and late menopause. Early menarche means menarche is when you start getting your periods first. And menopause when your periods stop completely. So women who have had an early menarche and late menopause are more prone to get breast cancer, because throughout your reproductive cycle, you are always constantly exposed to hormones in your body. So that is, it's seen that those who have gotten early menarche and late menopause, the breast cancers risk are more in them. And then the dense breast, because the screening becomes difficult in dense breast. The breast in itself is dense. So even the mammography, it becomes very difficult to pick up the disease. And definitely previous history of breast cancer. So those who had a cancer in one breast, they are more prone to get cancers in their other breast. Family history of ovarian cancer and breast cancer, and history of radiotherapy, especially for chest. Because of some other disease, if you have undergone a radiotherapy, then their chance of breast cancers are high. DES exposure, now to we don't use these medicines, so that's not one of the main concern about the risk factors for cancers. Then modifiable risk factors, sedentary lifestyle. If you have undergone a hormone replacement therapy and somebody who's an alcoholic or severely obese, those patients are more prone for breast cancers. So now we have seen who are at risk of getting a cancer. Now we'll be seeing how to do the screening so that we can detect these cancers early and can treat it as soon as possible. I've seen many patients, they come in very early stage of cancers and they are doing very well in their life without any zero recurrence of disease and absolutely living a normal life like a normal person. So there's no difference in their day-to-day activities or their any morbidity associated with their cancers, especially breast cancers. So there are three things which can be done. It's once like breast self-examination. You can do it every month yourself. You can screen yourself for the breast cancers or any mass. Next is clinical breast examination, which is done by a doctor. Like any qualified doctor, gynecologist or oncosurgeon can do these clinical breast examination. And next is when we feel there's a suspicious thing, we confirm with MRI and mammogram after the age of 40. So once a mammogram is done, like if it comes normal, you can do once in 2 years. And maybe after the age of 60, you can just stop screening yourself because then you're not prone for getting those breast cancers. So you don't have to do regular mammogram or mammography and all if they have a strong family history. So how we'll do a self breast examination? So when it should be done? It should be done between when your periods are just over, just after your periods, once in a month, you can do the self breast examination. And any person who's a postmenopausal can fix a date. This date I want to do it, so you can do it. Why we are saying after the periods? Because before periods, we have seen that there's a water retention. So when there's a water retention, already our breasts are very dense, hard, sometimes tender to examine. And so post periods, it becomes very easy to examine. So what you should do, stand in front of a mirror, just see, just observe the skin of the breast, how the breast looks like. If you feel any difference in the size of the breast previously, what you have noticed and what you are seeing today, then lift both the hands up in front of mirror and then check the level of nipples. Okay, whether both the nipples are the same level. If you see any of the nipples is retracted, means it has pulled up like this, or you feel it is like one of the nipple is low down, other is very high up, then there are chances there is some mass which is pulling it up. So there's it should be, you should immediately report to the doctor and get it investigated why your nipples are looking it's so retracted. Then check with your hands, especially flat of your hands. Never press both the breast tissue like this. Always check with the flat of your palms. So when you check from this palm, just palm, say circular motion, the breast tissue, you have to just in a circular motion examine your breast. You can do it in a lying down or a standing position and just see if you can feel any mass on it. So if you feel there's any mass, then better to get investigated and get it checked. Okay. So first what we'll do, we'll stand in front of a mirror. We'll lift both the hands up, see the level of nipple, color of our skin, any mass we can feel or we can see size of both the breasts and discharge, any bloody foul smelling discharge. Press the nipple with both the hands like this and see is there any bloody discharge coming from the nipples. Okay. So this you can do it in a lying down position or in a standing position when you're taking bath. Both the times it can be done. Then next what step? Next is we have to check the tail of the breast. Okay. So both the hands should be on the hip and then check here any mass is there near the neck clavicle region, or just a tail here in the breast. You can feel anything, any nose or anything. So if all these things are clear, then nothing to worry, everything is fine. But anywhere you feel there's a bump, there's a hard mass you can feel, immediately go and report to the doctor, and then they will investigate you further. So this is one of the main important thing for the breast self-examination. So I've already explained you all this thing. Then what all the things you have to see? Obviously, lump, any lump in the breast armpit, swelling of the breast, difference in skin color, especially red, orange, flaky skin. It will look like a actual mein orange, how the orange looks like. The skin will look like that. You can see the dots on that. And in that kind of, it's called PD orange skin. So that skin is a typical characteristic of a cancer. Then pulling of nipple, any nipple discharge, pain can be there, but only if it gets infected or there's some pus discharge. Pain is very less likely in cancers specifically, and change in size. So I think we have covered about the screening. So screening, mein what is important? Self-breast examination should be done every month by a woman herself, once in a year by a practitioner or a doctor. And if you're more than 40 or family history of cancers are there, then mammogram once in 2 years. Okay. And hope I'm clear this much. Not audible. Okay. I'm not audible. Can you hear me?
Yes, ma'am. Now audible.
Okay. So I'm not audible. So I was not audible so far.
Yeah, can you hear?
So what I've told, like
Yeah,
when we are
audible.
doing a breast, yeah, yeah. So breast examination, self breast examination by a consult, that is should be done once in a month. Then by a practitioner once in a year, and mammogram at least once in 2 years. Okay. So now we'll move to cervical cancers. So so far we have seen that breast cancers, when they detected early, they can be easily curable. And most of the breast cancers are curable, except the few when they are very fulminant. And sometimes, if we detect early, also, sometimes it becomes very difficult because they are already, by the time we detect, uh, their metastasis happen. But such cancers are very rare to happen. Okay. Next is cervical cancers. Cervical cancer is this mouth of the uterus, is cervix. Okay. So cervical cancers, who should we screen? Any woman who's sexually active more than the age of 21 years up to the age of 65. It depends on her previous screening reports. But from 21 or after sexual activity, cervical screening should be started. So there are two methods for cervical screening, that is pap smear and HPV testing. And how frequently? Pap smear every 3 years and HPV testing every 5 years. So what are the symptoms of cervical cancer? Cervical cancers, early cervical cancers may not be symptomatic. If it's an advanced stage, they can be foul smelling discharge vaginally, or some people may have bleeding, irregular bleeding, and bleeding after contact, after vaginal examination by a doctor, gynecologist, or any after sexual contact. So, most common is postcoital bleeding after cervical, in cervical cancer it is seen. So early cervical cancers may not have any symptoms. They are just diagnosed routinely on a gynec examination. Sometimes when we see patients, they are pregnant and we examine the cervix. And some patients, they come for other gynec complaints. And when we examine the cervix, we come to know that there is some changes in the cervix and we need to take a biopsy. Okay. So, as we know, cervical cancers, these are the common symptoms we should look for. Then screening. So for screening se pehle, I think we should look for the high risk factors. So risk factors, HPV infection. HPV is a kind of virus which is seen to be associated with the patients who are get infected by this those who have get affected by cervical cancer. So HPV infection is being seen more in such patients. So they are very variant of HPVs. Like they can be but few HPV viruses like 16, 11, 18, they are being seen that they are more associated with cervical cancers than other factors, HPV variants. So local poor hygiene, women with belonging to lower socioeconomic status, having multiple sexual partners, or those whose partners are having multiple sexual partners, tobacco, smoking, and immunocompromised persons. Immunocompromised person can be anyone who is suffering from HIV or any person who's on chemotherapy or any immunosuppressive drugs after transplant and all. Such patients are having a risk factors of getting any cervical cancers. So, as we see, this human papilloma virus is one of the virus which is being seen to be associated with the patients having cervical cancers. So they causes not only cervical cancers, but other sexually transmitted diseases also, like warts. So the warts, vaginal warts or a penile warts, are also caused by HPV virus. And HPV virus also cause vaginal cancers, even penile cancers in male. So it is usually transmitted sexually, and it causes the changes in the cervical cells. So what this pap test do? Pap test or a pap smear. So the whatever the fluid is around the cervix is taken with the help of a brush, and then it is examined under a microscope to see if any suspicious cells are there. Okay. So what is precancerous cells? Precancerous means there's no cancer yet, but some changes are already seen in the cell, which can convert into cancer. Maybe not immediately, but maybe after few years, 4, 5, 10 years. So what we are looking for? We are looking for precancerous cells as well as cancerous cells in a pap smear. Okay. So for cervical cancer screening, when it should be done, as I've already told, it should be done it should be started at the age of 21 years. And then depending on what test you are doing, HPV testing you are doing or a pap smear testing, it can be decided. If your past 10 years reports have come negative, then maybe you can decide to avoid screening after 10 years of your this thing. And once you cross 65 years, then if previous all reports were negative so far, then you can decide to avoid getting screening for cervical cancers. Normally, cervical scans it should be done like on the 7 to 8 date of periods, because we are not looking for the blood. If the blood is there in the smear, then the reporting will be a problem. We won't be able to see normal cells in the smear because these blood cells will interfere with the reporting. So we don't want the blood during the smears. So it should be done when you're not in your periods. And we don't want those cells also can disturb in the cervix. So no douching or vaginally anything should be tampons or anything should be used for at least 2 days. No medications and all. So that when we see the cervix, we are able to take out the smear from there and see those cells. Okay. So that we have discussed about the pap smear. So how it is taken? So it is taken like you will go and to a gynecologist. They will do an internal examination. How they see that for infections and all simultaneously, they can put a speculum and they can insert the speculum here and then take with the brush. Taito brush is there. So with the brush, they'll take the specimen from here and then we put it in the liquid, send it to the lab, and lab gives a report in 7 to 10 days. And usually the labs either it will come as a negative report, suspicious report, or a positive report. Okay. So if the negative report comes, then we have nothing to worry. Most of the time, it will show some inflammatory cells. You are having some kind of non-specific infection. Suspicious means precancerous cells are seen. So if it comes suspicious, then maybe your doctor will ask you to confirm with a biopsy. See, all these screening tests are only screening. It comes positive. It doesn't mean that you are suffering from the disease. It just tells that we have to do some more tests to confirm those diagnoses. So those more tests can be done only by the biopsy. Okay. So the same liquid, what we said, can be test for HPV DNA to see that what kind of virus, if any HPV infection is there in that woman, or any suspicious cells are there. Okay. So what is the prevention? Prevention is regular screening, use of condoms when you're sexually active, and HPV vaccine. So HPV vaccine, as we have already seen, in most of the cervical cancers, this is a preventable cause. This is like what I told that there are two factors, modifiable and non-modifiable. So HPV infection is a modifiable cause of cervical cancers. So if you prevent this HPV infection, almost 90% of the cervical cancers can be eliminated. So for this, um, there are four viruses which are seen most commonly associated with cervical cancer. There are 6, 11, 16, 18. So any vaccine, there are three type of vaccines in the market right now, only that bivalent, quadrivalent, and nanovalent. The bivalent vaccine has been withdrawn, so we don't use that bivalent anymore. But quadrivalent and nanovalent. Quadrivalent means there are four strains. Nanovalent means there are nine strains of viruses which commonly causes virus cancer. Okay, so who all can take HPV vaccine? HPV vaccine can be given to anyone, girl or a boy, because it prevents from penile cancers also. So boys, teenage boys also can take HPV vaccine, even the girls. So it should be given at the ideally should be given between 9 to 15 years of the age, but can be taken up to 45 years of age also. So anyone who's less than 15 years will require only two dosage, and more than 15 years will require three dosage of vaccine. And normal regimen is like 0 to 6. 0 means the day you get your vaccine, 2 is 2 months after your first dose, and 6 is 6 months after your first dose. Okay. I hope I'm clear till this point. So, again, I want to repeat HPV vaccine can be taken by both girls and boys. It prevents against cervical cancers, warts, vaginal cancers, and penile cancers. Quadrivalent and nanovalent vaccines are there. Quadrivalent are two brands which are coming in India. One is Gardasil and another is Serverac. Serverac is an Indian made company by Bharat Serum, which is much cheaper than Gardasil. It costs around 2,000 and Gardasil costs around 4,000. And nanovalent only Gardasil 9 is available in India and it is quite expensive. So per dose almost costs 10,800. Government is trying to incorporate this vaccination in their program. So Bharat Serum actually supplied a lot doses to the government, but I think they had some difference of opinion and finally they canceled the plan. So as of now, government hospitals they don't give HPV vaccines. And next we'll move to ovarian cancers. So far we have seen that breast cancers and cervical cancers. Both are very common cause of cancers. Ovarian cancers are very difficult to detect. They are one of the leading cause of deaths in the women because they are very difficult to detect and there's not a specific any screening program for a ovarian cancer which can specifically diagnose it very in a very early stage. So by the time we come to know that patient is suffering from ovarian cancers, they've already moved on to the later on stages. But still, we are trying to do something so that we can detect these ovarian cancers early. But so far, nothing has proved very foolproof to how to diagnose an ovarian cancer very early in the general population. So it should be cost effective, and it should be having good sensitivity and specificity also. So women who are in high risk are those who have family history of ovarian cancers, genetic mutations, BRCA1, BRCA2 diseases, those who have had a previous history of breast cancers, uterine colorectal cancers, and the history of endometriosis in them, and nulliparous. Nulliparous means those who have never conceived in their life, they those who don't have any babies, they are nulliparous. So such women, they have anovulation and their hormone levels are very high. So that is one of the reasons that it causes continuous stimulation on the ovary, and thus those ovaries can cells can become cancerous, and sometimes they change into cancer, and later on we can means we can see if they have got any ovarian cancers or not. So symptoms are very vague for ovarian cancers. There can be irregular vaginal bleeding, can be pressure symptom because they become very big. The cyst will be like 20, 30 centimeter in size, full of the abdomen, is full of that cyst. So it's it pushing all the organs, your bladder, your bowel, your stomach. So you're almost always feeling burpy, bloating, fullness, always having that pressure feeling, feel like passing urine again and again. Suddenly there will be fullness of abdomen. You feel your abdomen is abnormally distended. But ovarian cancers are very silent. So this is also not 100% proof, but still prevention, it is told those women who, it is seen that those who take oral contraceptive pills, the chances of ovarian cancers are less in them. So those who have many babies, they have seen that their chances of cancers, ovarian cancers are less than them. Those are breastfeeding because when you breastfeed, your all the hormones are very low levels. So when you breastfeed for a long time, the chances of cancers decreases in such women. So there is no reliable method. We should just pay attention to your body symptoms if there are any specific changes occurring in your body, and pay attention to that. And but what other things can be done? Any cyst, ovarian cyst, if it is diagnosed, it can be done only on ultrasound. So once in a year, you can do an ultrasound to see if there's an ovarian cyst. All the ovarian cysts are not cancers. There are so many types of cysts in the ovaries. So these cysts can be a benign cyst which form every month in our body, which is called as dominant follicle. They rupture, they form an egg, they get released, and then if the favorable conditions, then pregnancy occurs here. So most of the cysts are functional cysts. Like they form every month in the ovaries and they disappear on their own in 2 to 3 months. So any cyst, you should not be worried about whether it's an ovarian cancer. Usually cancerous cysts are very big in size. They are in both the ovaries. And when we do an ultrasound, we can see that these cysts are, they're having some solid structures inside. Even the septa, how they look, they everything is different when you do an ultrasound. So if anybody is telling you're having a cyst, that doesn't mean you're having a cancer. Okay. So ovarian cyst is, if it is there more than 8 centimeter, we should get investigated to rule out ovarian cancer. But any cyst, even more than 8 centimeter, not necessary, it will be a cancer. Okay. Next is a colorectal cancers. So colorectal cancers like colonic cancers or a rectal cancers. So who are more prone? Definitely who are more than 45 years of age. How it can be diagnosed by colonoscopy or a stool DNA testing and hematocrit testing of the stool. So risk factors, um, non-modifiable risk factors, those who are having irritable bowel syndromes, ulcerative colitis, or a Crohn's disease or celiac disease are more prone to get colorectal cancers. And those who are having a genetic family history of um, polypotosis, these syndrome, FAP and Lynch syndrome. Okay. So these are non-modifiable factors. So if you have these, what you can do, maybe you can just start screening yourself early, and if it is detected, you can get it treated. And other is a modifiable risk factors, that is a lifestyle associated factors. So lack of regular physical activities, diet low in fibers, fruits and vegetables, and eating a lot of processed food, meat, obesity, lot of alcohol and tobacco consumption. These are the modifiable risk factors. So, so far we have seen that most of the diseases are associated with sedentary lifestyle, smoking, and alcohol, and definitely a low fiber diet. So, if we follow a set pattern of lifestyle, that a healthy lifestyle, we can avoid so many diseases, so many cancers. So, prevention is regular screening, physical activity, low fat animal diet, and high greens and whole grain. Avoid tobacco and limit alcohol consumption. What are the common symptoms? Symptoms are like your bowel movements will get suddenly changed. There'll be narrow ribbon like stools. There can be sudden gush of bleeding when you're passing motion. There'll be bright red, dark red, altered colored blood you can see when passing motion. Always you feel like you have not emptied your bowel completely. You want to pass more motion. You're feeling just incomplete emptying of bowels. Suddenly undetected anemia. When we don't know what is the cause of anemia, you are feeling fatigued and tired. And when we do a routine blood examination, we see that hemoglobin levels are very low. And unexpected weight loss and persistent abdominal pain. So these are the common symptoms of bowel cancers, that is colorectal cancer. Who should be screened? So those who are having the family history or you are having irritable bowel syndrome should get screened after the age of 45 till the age of 75. Between 76 to 85, if your previous reports were negative, maybe you can avoid. If you feel there was any polyp, anything benign lesion was there, you should still continue screening yourself. Okay. So anyone above 75 can stop screening if all the previous reports were normal and nothing was detected on a routine screening in them. So for screening also, there are three methods. One is a routine screening, which is non-invasive. You don't have to do anything, just do stool examination for the blood. For that, there are three, four methods which can be done every year after the age of menopause in the woman. Just do a routine stool examination, look for blood. If there is no blood, nothing to be done. And once in 5 years, maybe at the age of 50 or a 55, just do a sigmoidoscopy or a colonoscopy to rule out if any benign lesions are there which are missed on a routine ultrasound, which cannot be seen. There are silent small polyps, so that those biopsy can be taken and send it for histopathology. And when we want to confirm, then CT colonoscopy can be done. So what is colonoscopy? Colonoscopy means they put a camera. It's a flexible wire with a camera at the tip of it, and then just screen throughout your bowel. Is they can see any abnormal mass, anything they can pick up. So that is a colonoscopy. And sigmoidoscopy means they just go till sigmoid. They don't cross that sigmoid, and up to sigmoid they can see if there are any masses there or not. And then next is lung cancers. Lung cancers obviously most common in the heavy smokers and those who are having a passive smoking or an active smoking. So how it can be done? It should be diagnosed only on a CT scan. It cannot be diagnosed in any other of the ways. So if a CT scan is done, only we can see if any lung masses are there or not. So what are the symptoms? There will be persistent cough, chest pain, difficulty in breathing, can be wheezing, fatigue, unexplained weight loss. So these are very vague symptoms which can be there in any of the lung diseases. So even lung cancers are difficult to diagnose. Who are more prone for getting a lung cancer? Those who are having more than 20 packs per year. The history of smoking cigarettes specifically. So anyone who's having more than one pack per day or 1 to 2 packs per day for at least 20 to 40 years, total 20 packs per year, are more prone in the age group of 50 to 80 years of the having the more prone for having lung cancer. So if you're a chronic heavy smoker, better to get screened every year doing a low dose CT scan to see for any masses. So, so far, what can be done for any of the cancers? Best thing is to stay informed. So you know what are the signs and symptoms. Know about your body, how different you're feeling from yesterday. Do you feel there's sudden changes in the body, sudden weight loss, sudden fatigue is there, or your bowel movements have changed? Any change in your bleeding pattern, your periods pattern, and all. So be vigilant, give time to your body, see what is happening to you, so that you can, if anything happens, you can immediately, we can investigate and screen it and diagnose it early and treat it early. And regular screening, get vaccinated, that is HPV vaccine. And if you feel there is any risk factors, just talk to your doctor about your screening program. So, so far we have seen that breast cancer is the most common cause of deaths in the women, which is easily preventable because even you yourself can screen. You don't need any special test to see whether there's, you don't have to visit any special person to see whether there's any mass, anything. You can see yourself and screen yourself. So easily can be screened at home. And if you feel anything suspicious, you can just go to the doctor. And early detection always give a better outcomes. So any disease, if it is detected early, treated early, later on can be cured completely. And empower yourself with the knowledge. So all the women should know what is their rights, what they should do, and always give priority to your health first compared to others. Because if you are well, then only you can take care of others. So I think I was clear so far. If any doubts, you can ask me because I think I've tried to cover most of the topics, which is like most of the common cancers in the woman. So if any doubts, anything you feel "Okay, I was too fast, you are not able to follow me, or you really want to uh, ask me again about it, I can explain it again. And I really want you to note, all of you to note it down so that so much of information may not be possible to retain for a very long time. So it's always better to just note it down, the important points, so that it will be easy for you to remember it. Because Ilya had told you for an hour, so many things, information, so much of new information had given. So most of the time you won't be able to retain it maybe for maybe a week, but after a week you just forget and go back to your regular routine. And it will be like, acha tha lecture, and then over. But I want you to, all of you, to really incorporate all these things in your life. Means I want you to give importance, at least go for pap smear screening and breast examination regularly, because these two things are very important. Other, like as I've told, ovarian cancers, yeah, difficult to detect, so we may not be able to do much about it. But yearly scan, seeing for any abnormal cyst, abnormal mass, can get, we can investigate and look after it. Similarly, lung cancers. So if you are having a risk factors, if you don't come into that risk factors, then the chance of lung cancers are very less. And then colorectal cancers are more common with a strong family history of ovarian, breast, uterine, or colonic cancers. So those two cancers which are preventable in a very early stage are breast and cervical cancers. Um, anybody is having any doubt, anything, anybody is want to ask anything specifically can ask me.
Good afternoon, doctor. Hello, can you hear me?
Yeah, I can hear you. Tell me.
I am Dr. Sivaraj.
Hello.
Very nice presentation, Dr. Anuradha Madam.
Yes,
You have covered almost all the
thank you.
type of that cancer and the screening. I am friend of
Yes,
Mr. Ganeshan, your father-in-law.
yes, he told me. Hello?
Now, can you hear me, madam? And we have the formula for these type of the cancers, the
Yes,
breast
your
cancer,
voice
lung.
is getting disconnected actually. Hello?
Now it's okay. Madam, now it's okay.
Yeah, I can hear you, but your voice is getting break actually. I can't hear it clearly.
Now we have that formulations. Now it is not related to this one. This is related to that our formulations. We have that formulations that will work for cancer, lung cancer, and prostate cancer and brain cancer. And we can prepare the other formulations also, maybe
Mhm.
work for that other type of that cancer. We want that right pharma company to take our formulation to the next level. So far, we are successful with that. We want to do that in vivo test or directly to sell our technology to that any pharma company. Can you support for our formulation, our R&D?
See, most of the pharma companies they have their own R&D. So I think they have got their own thing. Like I'm not a pharma person, so I really don't know how it works, the how the drugs and all launch. But I think first you have to take the pumps, you have to make it patent, and then they start a trial on that drug. And so first they start a trial on animals, and then they switch over to humans, and then their phases of trial are there. After the trials are over, and when they have substantial amount of study about the drug, then it is launched into the market. So as far as I think, it has to be it's a long process. So I really don't know how it things it works. Maybe if somebody from the past, this pharma can explain it better, because we are at the end when the all the phase trial are over, when the drugs get launched in the market, when all the evidence studies are there with us, we prescribe to our patients. So when a new drug is launched, how they it goes about things, I really don't know. But as far as I know, but when you do some research, you have to do it on animals first, and then that whatever the lab reports are there, you have to patent your drug, and then it comes to the phases of trial, small population, and then a big population, and then finally the medicine drug get launched.
I understand that one, but we want that any right party to do that joint venture or the transfer of technology. You have any pharma company directly?
See, there are so many pharma companies, but I have really, if you want, maybe I can find out, but I don't know. Means because at what level, how it works, I have no idea about it. So if you want, maybe I can ask, because what people we see are all the marketing people. We don't really see people from the research department. So if maybe I can find out how it works, and then I'll let you know. If I'll let you know my father-in-law, and then maybe he can
Father-in-law
go
is
about it.
your father-in-law is having that all our reports, and our reports are far better than that of that available drugs, platin, doxycycline, etc. Available drugs, and also it is having no side effect. Only thing is We want that
Okay.
support to take to the next level.
Next session. Okay, okay.
Or we can speak separately
So
because
anybody
it
is
is next
having
session
any doubts or
related to that.
anything? Please.
Thank you. Thank
Hello.
you.
Yeah, thank you. So, those who are joined now, I just want to summarize. So, all the cancers, they have two risk factors. One is modifiable, one is non-modifiable risk factors. So, modifiable risk factors are like related to our lifestyle, what we eat, smoking cessation, tobacco smoking, complete cessation, alcohol, avoiding alcohol, maintaining a healthy weight and a fiber-rich diet, and non-modifiable risk factors when those who are having a genetic family history of cancers. For breast cancers, they are BRCA1 and BRCA2 genes. And for other cancers, like those who are having a risk of ovarian cancers in the family, breast cancers, colonic cancers, they are more risk for getting such cancers in them. So they are non-modifiable cancers. But early screening can definitely prevent all the diseases. So screening means when we detect all the disease in a very early stage, when they're we ourselves don't know that we are having the disease. So that is called a screening. Screening breast cancer by self breast examination. Uh, that is done every month, then once a month by a doctor, and then mammography at the age of 40. That should be done once in 2 years. Okay, till the age of 65, it can be done. Cervical cancers, the screening is done by HPV vaccine, HPV testing, HPV DNA testing, which is an HPV is a virus which causes cancer, and then pap smear. HPV testing is done once in 5 years, and pap smear testing is done once in 3 years. So if both the results are negative for last past 10 years, maybe next you can avoid doing this screening. Then colorectal cancers, screening is done by stool examination. You have to see the blood. And then colonoscopy if you are having high risk of getting colonic cancers, that is a family history of cancers, irritable bowel diseases, or if you're having a lifestyle issues like eating a lot of spicy, non-fiber, high fat uh, diet. Okay. So what we can do, stool examination for the blood, all menopausal ladies once in a year should be done, and colonoscopy once in 5 years, and uh, if it is negative, then maybe once in 10 years. If it is negative, you can stop doing after the age of 65. Ovarian cancers, lung cancers are difficult to detect. There is no specific test to do it. Ovarian cancers, once in a year, you can do an ultrasound. If any suspicious cyst, should be taken biopsy and send it for histopathology. If you're a heavy smoker, then you should start screening yourself by the low dose CT scan. Okay. So this was the total summary so far. And if any doubts are there, you can message me privately and ask regarding to this topic. You can ask me later on, or I need a suggestion also. What more topics you want me to cover it? So next topic I'm planning to take is menstrual hygiene and adolescent health, adolescent girls ka health. Okay. So I really highly appreciate for all the people who joined me for this session. And even last time when I joined it, I thought not even a single person will join, but I was very determined. If a single person also joins me, I will educate that person and see to it that it is very clear how to take care of yourself. So last session and this session, I'm very happy that so many people joined me, and they're happy and they want to take initiative, uh, how to take care of themselves, and really want to know how to care and believe in preventive medicine. So preventive medicine is very important for us. So next we'll be talking about menstrual hygiene and adolescent medicine. Okay. So I think we'll stop here from this session. If anybody wants to connect to me, maybe they can send me a message and ask me the question. If any doubt, I was not able to clear it regarding the screening about the cancers in women.
Congratulations. Thank you for the nice presentation.